Hi everyone, my name's Rebecca Crosland. I'm the Head of Health and Safety at BESA, and I have a short presentation today just to show you the state of things regarding the pandemic and how we can all move safely back into the workplace without endangering anybody else. We've got a hard job ahead of us. The numbers are going up as we speak. The next slide will show you that when we're looking at coronavirus, the R numbers going up in all areas. It's really important to remember that your behaviour now, and I'm going to repeat this at the end of the session, will have a massive impact on how we deal with coronavirus going into the winter months, but also going forward into the new year. So the R numbers here on the screen in a minute will show you how they've gone up, and these have gone up since last week. So, and I've got these for all different nations. So for the UK, it's 1 to 1.3. Sorry. For Scotland, it's bordering on nearly 1.2, the top level. Then we have Wales at 0.9 to 1.1, and again that figure's still going up. Northern Ireland 0.9 to 1.15. Again, the figures are still going up. Death from COVID have risen 12% or 12.5% in the last week. And we currently have the highest case number since July. Really important to remember that COVID can affect anyone, even if you've had the booster vaccinations. Going to give you some personal stuff here. My father has just had COVID. He had both vaccinations, had his booster vaccination. He's 84, and then he contracted COVID and came up positive on a PCR test. He's been really quite ill, not hospitalized, but still really quite ill. So when we're looking at COVID, we need to remember that there are others that are going to be more vulnerable. They can be old people, they could be people with cancer, or they could simply be your workmate who has diabetes. Even though you've had the vaccination, you're still susceptible to actually contracting COVID moving forward. Where can you get further information on your R number? We have some really good website addresses here, which will be available after the conference if you don't have time to look at them now. And these are all the different sites that are available, and you will find the current R number for each different nation here. The other thing really important to remember is if you cross-border travel, if you're traveling anywhere really, if you're a contractor or you're an employer that has people that are going out to different areas, to make sure that you check the local authority guidance. And there's a local authority website for every local authority. There may be there's a spike in R numbers, and you need to make sure that if somebody's going to a place that has got lots of people, that they have more protection than they would currently have. So making sure you look out for everybody, making sure you know where you're going and what those regulations are. For instance, in Scotland, you have to wear a face covering on public transport. In England, in most places, you don't. So it's really important to remember to cross over. My opinion is you should be wearing a face covering no matter what. So it doesn't matter if you're in Wales, England, Scotland, Northern Ireland, wear your face covering if you're in places where there's going to be lots of concentrations of people. How do we keep moving forward? Really difficult, but the key concern for every employer at the moment is the health and safety and well-being of everybody on site has got to be a priority moving forward into next year. But also at the moment, as I said at the beginning, what you do now will have a massive impact on the next couple of months. And we really don't want to see those numbers going any higher than they are already. Question. The biggest question I've had in the last 4 months is, yep, we're going back to the office, we're doing hybrid working, but what about air conditioning? Can it spread COVID? Can it do this? Can it do that? So you need to ask yourself the question, how well do you know your HVAC systems? How well, are they maintained? But also look at the advice that's out there and that's given. So the key concern is that they're not spreading the coronavirus through the building to visitors, contractors, and indeed employees. when we're looking at this, SHEP have produced a really useful webinar. It was hosted by BESA and it had our expert Graham Fox there, but also BOHS and the HSE. And what they've done is they've created a webinar that gives you all the answers to all your questions. So if you're really not sure about your air conditioning system, if you're a health and safety consultant or indeed a health and safety person that's employed by your company, that's where you're going to find all your best information regarding COVID and how you can stop the spread through your air conditioning systems. There's also some really useful advice. Um, it's really difficult to say just open windows. From a health and safety point of view, there are lots of individuals that may be vulnerable to cold situations that have other medical issues. So it's not always right to open the window. However, you have to provide the airflow and you have to make sure that those systems provide safe air for people to breathe. So by all means, click the link. The SHEP website has there's loads of useful information. SHEP is made up of the HSE and lots of other organisations that have worked together through the pandemic. Not just the pandemic, we're concentrating on things that can affect people's health. And one of the things in engineering is welding and metalwork fluid, which I'll cover a bit at the end. Working safely on sites and in offices is going to be key as we move forward through the winter, but also into 2022. Can't believe it's 2022. Wow. Um, we have a BESA ECA COVID-19 experts panel, and we have a lot of experts on there. Paul Reeve is one from the ECA, so it's made up of ECA and BESA members. But since the start of the pandemic, these experts have produced some really brilliant guidance. What we've done is we've looked at that guidance, reviewed it, updated it, and put it into a guidance booklet, which is available on the the BESA COVID-19 information section on the BESA website. And it's basically support for COVID-19, but how you can also keep working. So there's support for things like close working situations, but also support if you have to go into a high risk situation, such as a care home or a hospital. So really, really useful advice. And again, I will provide you with the link. The BESA ECA COVID-19 panel, soon to be the BESA ECA Health and Safety Committee, is a collective of over 30, I would consider health and safety experts, not practitioners. And they've put their heart and soul into this guidance. And they're looking forward to the future as well. The panel is also starting to look forward into how we can keep the expertise we've got, but also live with COVID and concentrate on more health and safety issues that are actually affecting the industry. There's the link. So if you haven't had a chance to watch this, if you've come in half the way through, there are the links that you can follow to the specific information. Site working and COVID-19, every site's going to be different depending on the site you're working on. What I've heard so far is some sites are really, really enforcing COVID-19. Some sites aren't. Just depends on what site you're on. So it's about training your employees and your contractors to follow safe procedures anyway, even if it's not enforced on site. You know, people say, oh, you can go as close as you like now in the UK, and there's different parameters for wherever you are. Try and keep 2 meters apart. If you can't, that's fine, but use those mitigating measures such as lateral flow and wearing a face covering. You need to pay close attention to worker behaviour. The CICV forum website has some really good animations, just reminding employees, be careful in your personal time as well as when you're at work. Before you go to each site, check with the site manager, the office manager, whoever it is, principal contractor, what those actual local COVID controls are. It may be you need to provide a lateral flow test. If you don't know, then you can't do it. So make sure you check before you go. Working on site in Scotland, as I said, the CICV forum is very similar, perhaps bigger than the ECA BESA experts panel, but they're a collective of different trade and professional bodies. And what they've done is they've gathered together to produce some absolutely priceless guidance. And we've not just produced this to members, we've produced this to everybody, so that everybody can get the benefit. They produce the CICV COVID-19 construction operating guidance. And what this does is it gives you a bit more information than the government high level guidance has given you. Don't just think about this in terms of Scotland. This guidance can be taken from the website and then changed to your particular requirements. There's not that much difference apart from basically face coverings, really. So you could actually use this guidance for both the UK, Wales, Scotland, and Northern Ireland for that matter. And there's a link there direct to the guidance if you need it. We've recently updated it as well to incorporate anything extra that the Scottish Government wanted us to do. We've very much mirrored sort of what the Scottish Government have asked us to do, but we've also added in our own bits. This time we've not actually mirrored. We've gone on the side of caution, and we realised that what we've actually put in the guidance is safe. So if you've got to go any closer than 2 meters, then you need to do a risk assessment and just look at who's vulnerable, look at the employees you're working with. But also a very poignant thing is to look at what they're doing. You spew out a lot more of the virus if you're involved in a lot of physical activity rather than if you're just quietly standing there doing nothing. So really, really important. We have a picture of it there. So if you go on the CICV forum, there's all the guidance and you just download it basically and it's there for the taking. Domestic workers, if you have anybody that's domestic working, consider customer behaviour. So if you're an employer that sends people out to customers' homes or indeed any public buildings, then you need to consider that those people are going to keep your employees safe. So it's making sure that the customer knows what you want. If they're aware of COVID, if they're still remembering that COVID is still a pandemic. Do they know what to expect when you call? Can you ask them to open doors and windows, making your environment safer? Will they follow the social distancing guidance to keep you safe? If they won't, do you have a procedure to make sure that if they won't follow that guidance, what your workers need to do moving forward? Again, CICV, we've produced a document, work on in domestic properties, and that basically is the mantra for keeping your employees safe when they're going out to work in domestic properties. Again, it's aimed at Scotland, but it can easily be changed for the UK. So take a look at the guidance and see what you think. By all means, if you think we could improve the guidance or put something extra in it to benefit people, let us know as well. The key message is that if you're a domestic worker, you've got to be even more careful. So if your social life is one where you go out to clubs and pubs and things, you've got to consider, are you going to be bringing that virus back into your work community? It's been updated again, as I said, because of the recent update from Scotland. But again, it's very similar. We've put an update on what to do if somebody feels unwell when they're on site and what further advice you need to get as well. We all know how to keep ourselves safe. I'm not going to read through all of these things. Face coverings are really important at the moment. What you don't wear now could mean that we're locked down again over Christmas and New Year. Wear your face covering. Even if you don't have to, doesn't mean you shouldn't. That's a really important message. A lot of people are like, oh, yeah, it's not enforced. Doesn't matter. You could be making the person you sit next to on the train seriously, seriously ill if they haven't had the vaccination, but also giving them a viral load to take home to somebody that, again, is really not very well. Consider things like keeping 2 meters where you can. If you can't, that's fine, but but look at those mitigating measures. If you have to go closer in a queue, pop on that face covering. Um, in offices and indoor spaces, consider what people are doing. If they're exerting themselves, they're going to be spewing out a lot more of the virus, but also make sure you increase ventilation by either opening a window or obviously looking at your ventilation systems. Keeping social distancing in your free time is also really, really important. Again, the risk when you go from 2 meters to 1 meter is 10 times higher without mitigations. Those mitigations are vaccinations, second vaccinations, booster vaccinations, face coverings, washing hands, lateral flow test. Interesting to note that the numbers of people ordering lateral flow tests has gone down recently, massively down. We still need to do those lateral flow tests moving forward. People who have been vaccinated will still carry the same viral load as somebody that hasn't. So when you're thinking about, oh, I can't be bothered to wear my face covering, think of all those people that perhaps you don't know. Perhaps it's a worker's wife who's going through cancer. Perhaps it's somebody that's pregnant. You're protecting them from you, even though you've been vaccinated. So face coverings are key, but also lateral flow testing as well going forward. Healthy coronavirus protocol. Again, I'm not going to read through these. You know, wash your hands, stay home if you're sick. And that means even if you think you got the flu or the cold, do the test. Get a PCR or a lateral flow test to confirm that you're not going to carry that. If you're sick with the flu, don't go into work. Flu's going to be huge this year. A lot of people won't take up the option of the flu vaccine. So again, make sure that if you're not well, you don't go into work. When your turn comes, if you can, if you're open to it, please get your booster vaccination. If you haven't already got vaccinated, please get vaccinated. People that are getting sick at the moment are the ones that haven't had the vaccination or have only had one dose. Whether you're vaccinated or not, if you're living with a chronic health condition, you need to be really careful at the moment. Numbers are going up, like I said, and this virus doesn't play well with anybody that has some sort of underlying health condition. Please help to protect people that you're not absolutely aware of that could be vulnerable. And it could be your workmate whose wife's got cancer, or it could be that person that you connect with in the coffee shop. Wear your face covering. So we're looking at long COVID here. The CICV have produced a checklist. For some people, coronavirus can cause symptoms that last quite a long time, and there's no parameters here for time. But some of the symptoms of long COVID are really not very nice. You'll see them all on the long COVID checklist. Really important if somebody does a safety critical task that they are asked the question. A lot of people won't tell you they're suffering from long COVID, but if you're sending somebody up a scaffold, then you need to know they're not going to get any dizzy spells caused by long COVID. The list is very simple. It goes through the questions, but it also has a refer to box. So if you're not sure, you can refer them back to their GP, or if you're lucky enough to have an occupational health department, you can refer them to them. There's also lots of very useful links that take you to further information and advice that you might need regarding long COVID. Really, really take this to heart. If you don't need it, share it with somebody that does. This is something that hasn't been addressed by the industry yet. There are lots of people suffering from long COVID. Lots of people will suffer from it for maybe 2-3 weeks, but there are other people that are suffering serious health conditions. I know of two. One is suffering from brain fog, so seriously can't remember anything, but the other one has serious dizzy spells and tiredness issues. Don't just think about the list, so the HSE list for long COVID. Think about anything that could be determined as safety critical through risk assessment. So if you're asking somebody to drive 7 hours from, say, Cumbria to Essex, if they've got long COVID and they have dizzy spells and they feel very tired, it may not be the best thing to do. We're not asking you to exclude these workers, just find solutions so they can continue working, but safely until they're ready to resume um, their duties as before. And again, I've given you a link there to download the document. Travel reminder, I don't need to tell you, the virus is still out there. If people of different households are traveling together, it's really important to make sure that you have measures in place. Again, face coverings, windows open. Um, if you're traveling with non-household members, then you need to look at the number of passengers and start looking at lateral flow testing and wearing those face coverings as well. If you can, if it's possible, keep people traveling together in the same groups. And again, as I said, lateral flow testing is key. And also remember, there may be other regulations you need to follow if you're cross-border working. So especially on public transport, the rules are quite different. So make sure you check before you go so you know what you're supposed to be doing. Spot checks and inspections by the HSE, they're still doing COVID spot inspections. The BESA's produced a checklist that's available, and we did this through the CICV again. And this just tells you what to expect, but also the questions that may be asked. So again, a really, really good checklist to let you know what you might be asked, but also to get you to check that you have those controls that are expected in place. Again, there is a link to the document, but it's designed to basically allow you to prepare answers, but also to check that that's actually happening as we move forward. The HSE are about everywhere in all of the nations, and they're a really good organisation. And in the first instance, they just want to give advice. But if obviously you don't take that advice on board, then they'll obviously levy other actions going forward. Don't forget other hazards and risks. People are tired. We've had COVID for a year and a half now. Again, the HSE are doing other inspections. The main one at the moment is the metalwork and fluid inspections. They're now going to continue till March 2022. That's mainly because what they found was so awful. So of the metalworking fluid issues they found, it was a lack of LEV, insufficient LEV, lack of monitoring, timers on enclosed machinery seemed to be not working, allowing the machine to be opened before all the fume had been extracted, again risking the employee's health. And worryingly, only half of the premises visited had actual health surveillance, which was worrying. Again, the same thing was found with welding. Only premises visited had health surveillance. The issues found were lack of LEV or incorrect setup of LEV. So the LEV wasn't capturing all the weld fume. Insufficient face masks, complete lack of face masks, but also lack of face fit testing. So really important if you're going to put somebody in tight fitting RPE that you get them face fit tested. Using a fit to fit accredited tester will afford you the best protection and your employees and will make sure the job's done right. But again, really worrying. This is what they found now. Unfortunately, this is you're getting this information from a very kind comment from a HSE guy that I'm dealing with on the issue, who's actually involved in the inspections. But the actual results of these inspections aren't going to be ready until I think it's June 2022. And my worry is we have this issue now. We don't want to leave it that long. So if you know anybody that's welding, again, there is a very, very useful webinar that was done by Shep, and I'll put the link here now. And it's everything to do with welding fume, metalworking fluid, and what your duties are, but how to achieve those duties going forward. So again, another excellent webinar. There's a recording there if you want to look at it. And that really brings me to the end of the presentation. I just wanted to say thank you so much for taking the time to come to the BESA conference, but also take all of this information to heart. The coronavirus is not over yet. We have another version of it that is raising its ugly head. So World Health Organization website is another really useful resource where you can get further information. And then, yeah, it's just on to any questions, if anybody's got any questions at all. Yep, there's no questions at the moment that I can see anyway. No worries. So thank you, everyone. It's the end of the health and safety presentation. My email's out there, so if you have any questions after this presentation that are burning, please feel free to contact me directly or contact, obviously, BESA advice line, and they'll send the questions through. But thank you so much for attending and have a really good day.